consent form as well, where we not just only look at the imaging, but also look at things in the urine. And so before we have, at some point in time, it's over on the other building, where we'll go ahead and we'll collect a urine sample from you when you need to go to the restroom. And so there'll be a little cup that we'll get that. And then, as I'll mention this other consent form, if there's any that's left over, we'll store that with your consent so that we can utilize that for any future studies that come up as well, which is really exciting. That way you don't have to come back, but we have that information that we can continue to look at and utilize. So for what you'll do here today, and this, it mentions it a couple times, and I'm going to kind of talk about all three of these studies here together for a moment. So what we'll do is I'm going to talk to you about some paperwork. We're going to go through the consent forms. I'm going to ask you some questions to make sure that you're safe to get the magnet. And then we'll talk about some information for your medical history and some other pieces there. Then we'll go in the magnet. We're going to do some imaging. We're going to do some imaging from all the way up from just below the chin, all the way down to the ankles, some whole body imaging. We're going to look at some specific imaging as well of the legs and the arms. And we're going to look at some chest things where we'll have you do some breathing to be able to look at some of the muscles that tie in.
I just need his backpack. It was in here.
Is that one there?
I assume if that is not anybody in
This
here.
is not your backpack, correct? Normal or Benita?
Okay.
So, thank you, Anita.
Sorry. I forgot it was in here. Thank
Thanks,
you.
Alexandria. So we'll also have you do some breathing in the magnet. So we'll look at some of the muscles that are involved in respiration as well as lung expansion. When we finish with everything there, we're going to go over to another building where we'll do some functional testing. So we'll look at your mobility. We'll see with regards to walking. We'll see with regards to some strength. We'll see with regards to how you use your arms with some tests. And we'll do some breathing tests over there as well, some functional measures, so we can relate those back to what we're seeing on the imaging, which should give us some very good information as well. While we're over there, there will be a nurse. If it's okay with you, we'll do a little blood draw to be able to look at some markers in the blood, if that's okay. And then we're all finished, we'll come back over here for some final imaging, and we purposely break those up into two parts to be able to look to see how they can be compared morning and afternoon. So it's a full day, but we'll get everything in there. Okay, so in a nutshell, that's everything we're going to do today. And we'll have you back for one of these studies, we'll have you back every year. For the other study, we'll have you back in 6-month intervals to be able to look and do these similar kinds of things. And then ultimately at one of these visits, we'll have you where there will be a muscle biopsy. That will be a muscle biopsy of the thigh and of the lower leg. But that won't be today, but in the future. Do you have any questions or concerns about all of those items that I went through?
No.
Okay, so that was, again, in a nutshell, as far as, because it talks about all this in here. There are, with anything we do, there's always potential risks and discomforts. And so the magnet is a really loud magnet. So we're going to make sure that you have earplugs and a headset to protect your hearing, to keep you safe there. I'm also going to, as I mentioned, ask you questions to make sure you're safe to get in the magnet, similar to what you've already been asked, to make sure there's no metal in your body that would make it unsafe for you to go in the magnet. The magnet itself, have you had an MRI before in your mall?
No.
So it's like a big donut. There's a circle about this big, and there's a table that's about twice as long as this and about not quite as wide, where we'll have you lie down with a pillow, we'll get you comfortable, and we'll put some pieces on top of your body to help focus where we're going to be taking the pictures or the images, and then you'll slide in that donut. Sometimes people get a little claustrophobic or feel like that's a tight space. It won't be pressing or compressing on you at all. You'll still be able to breathe, and you'll make sure that you're comfortable with things there. But that is a risk for some people. When we do the testing for the breathing, the functional, and the strength testing, there's a risk somebody may get a little sore in muscles, or there's always a risk of doing anything that somebody may fall. We're going to minimize that to make sure that you're comfortable, that we give you adequate rest breaks, and I'll be with you, and Onima will be with you to make sure that we keep you as safe as we can for all of the testing, okay? And then for a muscle biopsy, which will be in the future, there's always a risk of bruising, bleeding, pain, or muscle soreness that can last up to 3 days after a muscle biopsy. And there's a rare risk of an allergic reaction to any of the numbing medicine they use before giving the biopsy. And then the blood draw can cause a little bit of bleeding and or bruising or pain. That's why we have a nurse who's very skilled to make sure she does it just perfectly. Okay? They do it very, I should say, we have some nurses, we also have a male nurse, so it could be him, he's good too. I don't want to, if you have him come
To draw the blood, my nose will not show here. They have that?
Get it?